Welcome to the next video. This video is part of a series of videos about me and my therapy program. In this video, I'll be outlining my theoretical orientation, therapeutic approach, and philosophy of human behavior. My name is James Fitzgerald. I'm a Vermont State licensed clinical mental health counselor, a national certified counselor by the National Board of Certified Counselors, a member in good standing of the American Counseling Association, and an active member of the Vermont Counseling Network. Before you watch this video, please familiarize yourself with the terms and conditions of use. Those are located in a post on the community page of this channel. This video is offered in the public domain, but is intended for my therapy clients seeing me in my private practice. The way I practice therapy is focused on the client, allowing them to lead the way while I take on the role of a guide and confidant. Think of yourself as the captain and imagine that your psyche, your internal system, is your ship. While you determine the ship's course and speed, I am fulfilling the role of your navigator, making your way in the world. I believe that a person's values and strengths of character can drive healthy ways of sensing, thinking, feeling, relating, and being. I believe that the individual can find solutions to problems and challenges given the right environment to explore their strengths and skills. I believe that relationships, experiences, and events can have lasting effects on a person's emotional, mental, physical, and spiritual health and well-being. I believe that a person's biology, genetics, environment, culture, religion, community, and physical and mental health has a profound influence on their personality development. I practice therapy from a humanistic, existential, integrated approach that considers multiple dimensions of philosophy and psychology. The dimensions include core beliefs, values, morals, narratives, assumptions, expectations, intentions, motivation, ethics, central nervous system functions, reactive physical sensations, emotions, automatic thoughts, meaning making, processing events, reactions, and secondary emotions, sensations, and thought patterns. I focus on what people do right for their health and wellness rather than focusing on what is wrong with them. My goal is not to fix people. Instead, I work with them to discover the best approach that fits them. I believe in a holistic approach to improving overall health and wellness, including integrated work with the cognitive mind, physical brain and body, consciousness or spirit, and shadow or memories. Theoretical orientation in the field of psychotherapy and counseling refers to the foundational beliefs, assumptions, and principles that guide a clinician's approach to understanding clients' behaviors, problems, and life situations. Essentially, it is the lens through which therapists view their clients' challenges and the method by which they approach treatment. The clinician's orientation not only influences the types of questions a therapist might ask, but also dictates the strategies and interventions they consider most effective for addressing various psychological issues. Theoretical orientation plays a pivotal role in shaping the therapeutic process. It affects how therapists conceptualize their clients' difficulties, the goals they prioritize in therapy, and the therapeutic techniques they employ. For instance, a therapist with a psychodynamic orientation might focus on unconscious processes and past experiences as they relate to current behaviors. In contrast, a cognitive behavioral therapist will typically look at the interplay between thoughts, feelings, and behaviors, emphasizing direct intervention. Each orientation comes with its own set of tools and approaches, tailored to its underlying theory. Eclectic and integrative approaches in counseling are responses to the diverse and complex nature of human psychology, acknowledging that no single theoretical orientation can comprehensively address all aspects of the human experience. An eclectic approach involves selecting the best suited techniques from multiple orientations to tailor therapy to the individual client's needs. An eclectic therapist might use techniques from CBT for a client's anxiety symptoms while incorporating psychodynamic strategies for exploring underlying relationship issues. An integrative approach goes a step further by blending elements from different theories into a cohesive theoretical framework. This isn't merely about technique selection, but involves synthesizing and harmonizing diverse theoretical perspectives into a new coherent whole. Integrating different therapeutic models presents challenges, primarily because each is often founded on differing, sometimes conflicting theoretical principles. However, thoughtful integration can lead to a more flexible and comprehensive approach to therapy. I tend to view health and wellness within a sociological perspective of interdependence between the individual and the collective. Through a moderate, central federalist, democratic, free market, equitable, inclusive, and socialist lens, believing in the inherent right of every individual to access resources and guidance to achieve optimal well-being and financial security. My somewhat progressive, not extremist perspective emphasizes the collective good, ensuring that my counseling and coaching is both inclusive and accessible. Rooted in values of democracy, equity, and shared responsibility, I am committed to creating an environment where every individual feels safe, seen, heard, understood, and empowered. As a dedicated mental health professional based in Burlington, Vermont, I am committed to providing compassionate and effective counseling services. With my licensure as a clinical mental health counselor and certification as a nationally certified counselor, I bring a comprehensive and integrative approach to therapy. My therapeutic orientation is grounded in a holistic and integrative perspective, emphasizing the interconnection of the cognitive, physiological, neurological, emotional, spiritual, cultural, interpersonal, and environmental domains. This approach is influenced by my practice in Buddhism, which informs my understanding of mindfulness and the pursuit of mental and emotional balance. I place a strong emphasis on creating a safe and non-judgmental space where clients can explore their thoughts and emotions. My approach is compassionate, empathetic, ethical, inclusive, and client-centered, recognizing the importance of individual experiences and perspectives. I use an integrative positive psychology approach to psychotherapy and counseling that is person-centered, strengths-based, empirically supported, evidence-based, somatic-centered, trauma-informed, culturally aware, and integrates mind-body approaches such as nutrition changes, polyvagal theory, body movement, and yoga. I adjust the approach to fit the client while strengthening the relationship between the client and myself. Moreover, my background in addiction counseling allows me to offer specialized support to individuals struggling with substance abuse, providing them with strategies for recovery and relapse prevention. As a health and wellness life coach, I incorporate aspects of mindfulness-based stress reduction, meditation, nutrition planning, exercise, sleep hygiene, and yoga into my practice, recognizing their significant impact on mental health. My goal is to not only address immediate mental health concerns, but also to empower clients towards a holistic sense of well-being. In addition to individual therapy, I am passionate about advocacy and activism, particularly in areas related to criminal justice, mental health, social justice, education, healthcare, housing, agriculture, ethical advances in technology, and environmental and climate change concerns. This advocacy is reflected in my therapeutic practice, where I strive to foster an environment of acceptance, understanding, and growth for all individuals. In the tapestry of human existence, every thread matters. Our lives are a complex interplay of our foundational makeup, internal experiences, and external influences. Let's explore this triad. We always start at the foundation. This is the bedrock of who we are. It encompasses our genetics, biology, neurology, inherent temperament, relationships, attachment styles, life experiences, significant events, and even multi-generational dynamics. These elements collectively shape our functional baseline, influencing how we perceive and interact with the world. Moving inward, we delve into our internal experiences. This is the realm of our core beliefs, values, strengths, virtues, and morals. It's where our schemas reside, the interpretations and perceptions that color our opinions and emotions. Here, interception brings awareness to our internal sensations, guiding our thoughts and decisions. Lastly, we consider the external influences. This involves our interactions with the environment and others, the circumstances we find ourselves in, our behaviors, and how we respond through actions, responding to antecedents, with our statements and reactions. Proprioception grounds us in our physical space, affecting how we navigate the world around us. In my therapeutic approach, I integrate a variety of evidence-based therapies to address each facet of this triad. Acceptance and commitment therapy is a form of psychotherapy that helps individuals embrace their thoughts and feelings rather than fighting or feeling guilty for them. It operates on the belief that by accepting negative thoughts as part of the human condition, individuals can focus on their values and move forward with actions that enrich their life. ACT combines mindfulness strategies with behavioral changes, aiming to increase psychological flexibility. This approach encourages individuals to notice, accept, and embrace their inner experiences, develop greater clarity about personal values, and commit to needed behavior change, regardless of what their thoughts and feelings are. It's particularly effective for treating a range of psychological disorders, including anxiety, depression, and stress, by teaching coping strategies that help manage harmful thoughts and feelings. Behavioral activation is a powerful and evidence-based intervention in cognitive behavioral therapy aimed at helping individuals engage in activities that promote positive emotions and reduce patterns of avoidance. Often used in treating depression, BA works by breaking the cycle of inactivity and negative thinking that can lead to feelings of hopelessness and isolation. The goal of this approach is to identify meaningful activities that align with a person's values and interests and gradually incorporate them into daily life to foster a sense of accomplishment and enjoyment. For those struggling with low motivation or feelings of discouragement, BA provides a structured approach to setting achievable goals and increasing positive reinforcement through rewarding experiences. By participating in enjoyable or purposeful activities, clients can experience an improvement in mood and motivation. Over time, these positive experiences can shift thought patterns and help clients feel more connected and engaged with their lives. As a core component of CBT, behavioral activation can empower clients to regain control over their routines and emotional well-being by focusing on action-oriented steps. This approach not only helps to lift mood, but also supports a more resilient mindset, as clients learn to challenge negative beliefs and embrace life with renewed energy and confidence. Cognitive behavioral therapy is a widely used psychological treatment that addresses dysfunctional emotions, behaviors, and cognitions through a goal-oriented systematic procedure. It is based on the cognitive model, which posits that thoughts, feelings, and behaviors are interconnected, and that individuals can overcome difficulties by identifying and changing unhelpful or inaccurate thinking, problematic behavior, and distressing emotional responses. CBT involves efforts to change thinking patterns and behaviors, teaching individuals to challenge distorted cognitions and change destructive patterns of behavior. It is empirically supported and has been shown to be effective in treating a variety of conditions, including depression, anxiety disorders, marital problems, and severe mental illness. Sessions are structured and collaborative, with therapists and clients working together to identify goals, learn new skills, and apply these skills to daily life. Compassion-focused therapy cultivates self-compassion, reducing self-criticism and promoting emotional healing. CFT is an evidence-based therapeutic approach that combines insights from evolutionary psychology, cognitive behavioral therapy, and mindfulness practices to cultivate self-compassion and alleviate feelings of shame and self-criticism. CFT is particularly helpful for individuals who struggle with high levels of self-judgment, low self-worth, or difficulties managing challenging emotions. By focusing on developing a compassionate mindset, CFT aims to reduce emotional suffering and enhance psychological resilience. This approach can empower clients to respond to themselves and others with greater empathy, warmth, and understanding, fostering a sense of inner peace and emotional well-being. Dialectical behavior therapy is a comprehensive cognitive behavioral treatment developed in the late 1980s for individuals experiencing significant emotional dysregulation and low tolerance to stress. It integrates strategies from cognitive behavioral therapy with concepts from Eastern mindfulness practices to focus on teaching skills in 4 key areas. 1. Mindfulness. The practice of being fully present and aware in the moment. 2. Distress tolerance. How to tolerate pain in difficult situations, not try to change it. 3. Emotion regulation. How to change emotions that you want to change. And 4. Interpersonal effectiveness. How to ask for what you want and say no, while maintaining self-respect in relationships with others. DBT is evidence-based and has been adapted for a variety of populations and settings, including adolescents, substance abuse, eating disorders, and depression, demonstrating effectiveness in reducing self-harm behaviors, suicidal ideation, and improving emotional stability. Emotion-focused therapy is an evidence-based therapeutic approach that emphasizes understanding and transforming emotional responses as a path to healing. Rooted in the idea that emotions are a key part of human experience and a primary guide to our thoughts and behaviors, EFT aims to help clients identify, process, and regulate their emotions effectively. In sessions, clients are guided to explore their emotional responses, uncovering underlying feelings and needs, and learning new ways to cope with and express their emotions in a healthy manner. This therapy is especially helpful in treating depression, anxiety, and trauma, and is widely used in couples therapy to foster empathy, communication, and connection between partners. Emotion-focused therapy is one approach that informs my practice, helping clients move through emotional blocks and build a more resilient, fulfilling life. Existential therapy is a form of psychotherapy that focuses on exploring the fundamental questions of human existence, such as the meaning and purpose of life, personal freedom, and the inevitability of death. Rather than focusing solely on symptom relief, existential therapy encourages clients to confront the deeper, often uncomfortable truths of human life. Through this process, clients are empowered to take responsibility for their choices, find meaning in their experiences, and create a life that aligns with their authentic values. In practice, existential therapy helps clients understand how they navigate issues of freedom, isolation, and meaninglessness, and how these existential concerns impact their mental and emotional well-being. It's a deeply reflective approach that invites clients to explore what truly matters to them and encourages them to live in a way that feels purposeful and fulfilling. For those who may feel stuck, disconnected, or searching for meaning, existential therapy offers a unique and introspective path forward. Feminist therapy is a therapeutic approach that centers around understanding and addressing the impact of social and cultural factors on mental health, particularly regarding gender, power, and identity. This therapy emphasizes empowerment, social justice, and the client's unique experiences within a patriarchal society. Feminist therapy recognizes that issues such as sexism, racism, and other forms of oppression can deeply influence personal struggles and mental health. It focuses on validating the client's lived experiences, fostering resilience, and encouraging clients to advocate for their needs and values. Through a collaborative, non-hierarchical relationship, feminist therapy seeks to help clients develop self-awareness, build empowerment, and challenge societal norms that may contribute to their distress. This approach aligns with my commitment to providing a supportive, inclusive, and socially conscious space for all clients. Gestalt therapy is a client-centered experiential approach that focuses on present moment awareness, self-discovery, and personal responsibility. Rooted in the idea that each person is a unified whole, mind, body, and emotions, it encourages clients to explore their thoughts, feelings, and actions in the here and now. By bringing awareness to unacknowledged emotions and unresolved conflicts, Gestalt therapy helps individuals gain insights into their patterns of behavior and relationships. Techniques like role-playing, body language exploration, and empty chair exercises enable clients to reconnect with parts of themselves and make empowered choices. This therapy promotes growth and healing by fostering a deeper connection with oneself, facilitating an authentic and fulfilling life. Humanistic psychology and secular humanism are grounded in the belief that people are innately good. This type of psychology holds that morality, ethical values, and good intentions are the driving forces of behavior, while adverse social or psychological experiences can be attributed to deviations from natural tendencies. Humanism incorporates a variety of therapeutic techniques, including Rogerian person-centered therapy, and often emphasizes a goal of self-actualization. There are several fundamental assumptions of humanistic psychology. Experiencing, thinking, sensing, perceiving, feeling, remembering, and so on is central. The subjective experience of the individual is the primary indicator of behavior. An accurate understanding of human behavior cannot be achieved by studying animals. Free will exists, and individuals should take personal responsibility for self-growth and fulfillment. Not all behavior is determined. Self-actualization, the need for a person to reach maximum potential, is natural. People are inherently good and will experience growth if provided with suitable conditions, especially during childhood. Each person and each experience is unique, so psychologists should treat each case individually, rather than rely on averages from group studies. Internal family systems therapy is an innovative and evidence-based form of psychotherapy that posits the mind is naturally made up of multiple subpersonalities or parts, which contain valuable qualities and may also carry burdensome beliefs and emotions from past experiences. IFS aims to promote healing by fostering a deeper understanding and harmonious relationship between the self and its parts. It encourages individuals to approach their inner world with curiosity, compassion, and openness, leading to self-discovery, emotional healing, and improved mental health. The core principle of IFS is that by achieving balance and harmony among these parts, and by recognizing the self as the compassionate, confident, and calm center of consciousness, individuals can heal from within, leading to greater well-being and relational improvements. Mindfulness-based cognitive therapy is a therapeutic approach that combines elements of cognitive behavioral therapy with mindfulness practices derived from Buddhist traditions. It is designed to help individuals who suffer from chronic depression, anxiety, and other mental health conditions by teaching them to focus on the present moment in a non-judgmental manner. The core premise of MBCT is to change the relationship individuals have with their thoughts and feelings, rather than trying to alter the content of their thoughts directly. This is achieved through mindfulness exercises and meditations that encourage awareness of thoughts, feelings, and bodily sensations as they arise. By fostering an attitude of acceptance and curiosity, MBCT aims to prevent the relapse of depression, reduce anxiety, and improve overall well-being. Mindfulness-based stress reduction is an evidence-based program designed to assist people in managing stress, anxiety, depression, and pain through mindfulness practices. Developed in the 1970s at the University of Massachusetts Medical School, MBSR combines mindfulness meditation, body awareness, and yoga to promote increased awareness of the mind-body connection and to cultivate a more mindful approach to life. The program typically spans 8 weeks and includes guided instruction and meditation practices, group discussions, and daily homework assignments. MBSR has been widely studied and is recognized for its benefits in improving mental and physical health outcomes, enhancing emotional regulation, and reducing symptoms of stress and anxiety. Motivational enhancement therapy is a client-centered counseling approach that aims to evoke rapid and internally motivated change, rather than guiding the client step by step through the recovery process. It incorporates elements of motivational interviewing, utilizing open-ended questions, affirmations, reflective listening, and summaries to build motivation and commitment to change. Socratic dialogue is employed to help clients explore and resolve ambivalences by asking insightful questions that lead them to consider the consequences of their behavior and the discrepancies between their current behaviors and broader life goals. Additionally, METI integrates the stages of change model, recognizing that clients are at different levels of readiness to change. Through this integration, therapists tailor their interventions to match the client's current stage of change, whether it be pre-contemplation, contemplation, preparation, action, or maintenance, thereby facilitating a more personalized and effective therapy process. This approach is effective in treating substance abuse and other behavioral issues by helping clients to recognize their problems and motivating them to make positive changes. Narrative therapy, an approach that helps individuals reframe their personal stories to foster positive change and resilience. Rooted in the belief that we all have unique and valuable perspectives, narrative therapy focuses on the stories people tell about their lives, relationships, and challenges. By working collaboratively, the therapist and client explore and reauthor these stories, separating the person from the problem and uncovering strengths, values, and possibilities that might have been overlooked. This process allows clients to develop a sense of agency, redefine their identities, and envision new ways of interacting with the world. Narrative therapy aligns with a client-centered approach, emphasizing respect, curiosity, and compassion, which makes it a valuable tool in helping clients find meaning, growth, and healing in their lives. Psychodynamic therapy is the psychological interpretation of mental and emotional processes. Rooted in traditional psychoanalysis, it draws from object relations, ego psychology, and self-psychology. It was developed as a simpler, less lengthy alternative to psychoanalysis. Psychodynamic therapy aims to address the foundation and formation of psychological processes. In this way, it seeks to reduce symptoms and improve people's lives. In psychodynamic therapy, therapists help people gain insight into their lives and present-day problems. They also evaluate patterns people develop over time. To do this, therapists review certain life factors with a person in therapy, emotions, thoughts, early life experiences, and beliefs. Recognizing recurring patterns can help people see how they avoid distress or develop defense mechanisms to cope. This insight may allow them to begin changing those patterns. Polyvagal theory is a groundbreaking concept in neuroscience that explores how our autonomic nervous system responds to stress and affects our emotional and social experiences. Central to this theory is the vagal nerve, a cranial nerve that influences key physiological processes, including heart rate, digestion, and respiratory function. According to polyvagal theory, the autonomic nervous system has three primary states. The social engagement state, where we feel calm and connected. The fight or flight state, where we experience heightened alertness and readiness. And the shutdown state, where we may feel numb or disconnected. This theory helps explain how our bodies naturally react to stress and trauma, sometimes in ways we may not consciously understand. By recognizing these responses, clients can gain a better understanding of their physiological reactions and learn to foster a sense of safety and connection. Polyvagal informed therapy, which integrates these principles, supports clients in working with their nervous system to cultivate resilience, self-regulation, and a deeper sense of well-being. Sensory motor psychotherapy is an innovative therapeutic approach that focuses on the mind-body connection to promote healing and growth. It combines traditional talk therapy with somatic body-centered techniques to address the impact of trauma, emotional distress, and other psychological issues. This approach recognizes that traumatic experiences can be stored in the body, leading to physical symptoms, emotional disturbances, and disrupted patterns of thinking and behavior. By incorporating body awareness, movement, and mindfulness techniques, sensory motor psychotherapy aims to release stored trauma, regulate the nervous system, and promote integration between the mind and body. During sessions, the therapist and client work together to explore and understand the client's bodily sensations, movements, and postures, as well as their emotions and thoughts. Through gentle experimentation and guided exercises, clients can learn to identify and manage triggers, access inner resources, and develop new coping strategies. Sensory motor psychotherapy can be particularly effective for individuals who have experienced trauma or have difficulty accessing and expressing their emotions verbally. It can help clients increase their self-awareness, cultivate resilience, and restore a sense of safety and empowerment. As a mental health counselor, incorporating sensory-motor psychotherapy into my practice allows me to offer a comprehensive and holistic approach to healing. I am dedicated to creating a safe and compassionate space where clients can explore their experiences and work towards personal growth and recovery using this body-centered approach. Somatic therapy is a holistic mind-body approach to mental health counseling that emphasizes the interconnectedness of mind and body to facilitate healing and wellness. It integrates several methods, including polyvagal theory, which explains how the vagal nerve bundles influence emotional regulation and social connection, somatic experiencing, which focuses on the body's response to trauma and stress, embodied self-awareness, which encourages an understanding of the physical self in the present moment, heart rate variability, which is used to assess the body's stress response and resilience, and sensory motor psychotherapy, which combines body-oriented techniques with psychotherapy to address the somatic symptoms of trauma. By focusing on the body's sensations and movements, somatic therapy aims to release tension, reduce symptoms of stress and trauma, and improve mental health outcomes. Positive psychology is a relatively new form of psychology. It emphasizes the positive influences in a person's life. These might include character strengths, optimistic emotions, and constructive institutions. This theory is based on the belief that happiness is derived from both emotional and mental factors. Positive psychology aims to help people identify happiness from moment to moment. It emphasizes this over only appreciating happy moments when looking back on them. People seeking therapy who desire to experience a greater sense of joy and liberation from their current circumstances may find this approach helpful. Many find it easier to focus on positive emotions they experience in the present after treatment has ended. Solution-focused brief therapy is a therapeutic approach that emphasizes building solutions rather than solving problems, focusing on the present and future instead of the past. It is grounded in the belief that clients have the resources and strengths to create change in their lives. Clinicians work with clients to identify and amplify these resources and strengths by setting clear, achievable goals. Sessions typically involve exploring instances of when the problem does not occur or is less severe, thus identifying what works for the client. This goal-directed approach is brief, typically involving fewer sessions than traditional psychotherapy, making it a cost-effective and time-efficient method for achieving behavioral change and improving well-being. Character strengths and virtues exploration helps identify and cultivate inherent strengths, promoting personal growth. One of the foundational resources I utilize in my therapeutic approach is the Handbook of Character Strengths and Virtues, a comprehensive classification system that identifies positive traits inherent in all of us. The handbook serves as a counterpart to traditional diagnostic manuals by focusing on what is right with people rather than what is wrong. It outlines 6 universal virtues: wisdom and knowledge, including creativity, curiosity, open-mindedness, love of learning, and perspective; courage, including honesty, bravery, persistence, and zest; humanity, including kindness, love, and social intelligence; justice, including fairness, leadership, and teamwork; temperance, including forgiveness, humility, prudence, and self-regulation; and transcendence, including appreciation of beauty, gratitude, hope, humor, and spirituality. The virtues are broken down into measurable character strengths that reflect our capacities for thinking, feeling, and behaving in ways that benefit ourselves and others. I'll have another video for you to learn more about the 6 virtues and 24 character strengths. The final philosophical area of psychology and human flourishing I integrate into my professional life and personal wellness practice is a secular, not religious, Buddhism approach. Many of the other approaches I've already discussed include some part of Eastern spiritual traditions, but you do not have to be a spiritual or religious person to benefit from the philosophy and psychology of Eastern traditions. I'd like to guide you through Buddhism's 4 Noble Truths, 8-fold Path, and 5 Precepts. In the context of my therapy program and as part of an approach informed by secular Buddhist philosophy, sharing insights from the 4 Noble Truths and the 8-fold Path provides you with a foundation for understanding suffering, well-being, and ethical living. These principles can support you in fostering mindful awareness and aligning with your values to enhance your mental, emotional, and social wellness. The 4 Noble Truths. The 4 Noble Truths are a central teaching in Buddhism, helping individuals confront and alleviate suffering with understanding and mindfulness. Here is a summary of these truths. 1. The truth of suffering. This truth acknowledges that suffering is an inherent part of the human experience. Life includes experiences of pain, dissatisfaction, loss, and hardship, all of which are universal and inevitable. 2. The cause of suffering. Suffering arises from attachment, desire, and craving. When individuals become attached to things, whether relationships, material possessions, or fixed beliefs, they create a dependency on external factors for happiness. This attachment can lead to frustration and suffering. 3. The end of suffering. Suffering can cease when people let go of attachment and craving. By releasing attachment and cultivating acceptance, individuals can experience peace, even amid life's challenges. 4. The path to the end of suffering. The path to freedom from suffering lies in practicing the 8-fold Path, which provides practical guidance on how to cultivate wisdom, ethical behavior, and mental discipline. The 8-fold Path is a guide for leading a balanced and purposeful life intended to cultivate wisdom, morality, and mental clarity. Each step is a practice rather than a strict rule, aimed at reducing suffering and increasing fulfillment. 1. Right understanding. Recognizing that all life involves suffering, and that it is possible to transform suffering through understanding and compassion. 2. Right intention. Developing the resolve to act with kindness, nonviolence, and compassion. This requires cultivating a mental orientation towards reducing harm and fostering goodwill. 3. Right speech. Speaking truthfully and mindfully, avoiding gossip, harsh words, and deceit. Right speech promotes harmony and mutual respect in relationships. 4. Right action. Engaging in ethical behavior by avoiding harm to others, refraining from violence, stealing, and harmful sexual conduct. 5. Right livelihood. Choosing a career or means of income that supports ethical principles and does not contribute to suffering for others or oneself. 6. Right effort. Developing and maintaining a consistent effort to cultivate wholesome states of mind while letting go of unwholesome mental states such as anger, jealousy, and greed. 7. Right mindfulness. Practicing awareness of body, feelings, thoughts, and surroundings. Mindfulness encourages individuals to live fully in the present moment, fostering insight and reducing impulsive reactions. 8. Right concentration. cultivating focused attention, often through meditation, to develop mental clarity, insight, and inner calm. This practice helps stabilize the mind and prepares one for deeper understanding. Lastly, let's look at the 5 precepts in secular Buddhism. Secular Buddhist practices encourage ethical precepts that act as guidelines for living harmoniously with oneself and others. These precepts are less about moral rigidity and more about mindfulness in action, aligning with an individual's values and intentions. 1. To refrain from harming living beings. This includes a commitment to nonviolence and compassion, not only in action but also in thoughts and intentions toward others and oneself. 2. To refrain from taking what is not given. This precept emphasizes honesty and respect for others' boundaries and possessions, promoting trust and respect in relationships. 3. To refrain from harmful sexual behavior. Here the focus is on consensual and respectful relationships, avoiding actions that exploit or harm others emotionally or physically. 4. To refrain from false speech. This precept encourages truthfulness, respect, and integrity in communication, recognizing the impact of words on others' well-being. 5. To refrain from intoxicants that cloud the mind. In secular contexts, this can mean moderating substances or behaviors that impair mindfulness and self-control, allowing for clear thinking and healthy decision-making. Integrating Buddhist principles into health and wellness is important to my eclectic program. By incorporating these elements of Buddhist philosophy, you're invited to understand suffering as a natural part of life and encouraged to cultivate a compassionate and mindful approach to your experiences. The Eightfold Path provides you with a framework for developing wisdom, ethical conduct, and mental clarity, while the precepts offer ethical guidelines that are universal in their support of harmony, integrity, and awareness. These teachings align with my health and wellness program's emphasis on strengthening your conscious self. They provide individuals like yourself with tools for self-reflection and promote a balanced approach to managing thoughts, behaviors, and relationships in ways that enhance your well-being and life satisfaction. By embracing this integrative approach, we honor the complexity of your experiences. We work to understand your foundation, nurture your internal world, and navigate your external environment. Every step of this journey is collaborative. Together, we'll tailor a therapeutic path that resonates with you, drawing from these diverse modalities to support your unique needs. At some point during our work together, you might want to take what you are working on in therapy sessions and apply it in your everyday life. This can be especially challenging given the nature of our society and culture. I will invite you to make a commitment to yourself and treat yourself as important or even more important than anyone else. Your career, your responsibilities, your family. At some point, I might ask you to read books, complete workbooks, watch videos, listen to podcasts, journal about your experiences, and practice skills in the real world. I might ask you to follow my professional social media pages and accounts, visit my professional websites, and log into the client account portal regularly, where I store and curate all the tools I provide and interventions I teach. I will encourage you to subscribe to my YouTube channel so you are notified of new content when it is added. I will try not to call these requests homework assignments. We can work together to help you organize your schedule to complete these assignments and work on improving yourself for you. Healing is not a destination, but a continuous journey of growth and self-compassion. Thank you for allowing me to be a part of your path toward holistic well-being. As always, please subscribe to the channel for notifications of new videos and share the channel with someone you think could benefit from this information. See you in the next video.